Breathing is something most people never think about until it becomes difficult. Imagine taking a deep breath, but your lungs feel stiff and unable to fully expand. Over time, even simple activities like walking or climbing stairs can leave you breathless. This is what many people experience with pulmonary fibrosis, a condition that gradually damages the lungs and makes breathing increasingly difficult. So what exactly is pulmonary fibrosis? Pulmonary fibrosis is a chronic lung disease in which lung tissue becomes scarred and thickened over time. The word fibrosis means scarring. As this scar tissue builds up, the lungs become less flexible, making it harder for them to expand and contract normally. To understand this, remember that healthy lungs contain millions of tiny air sacs called alveoli, where oxygen passes into the bloodstream and carbon dioxide is removed. The walls of these air sacs are normally thin and flexible, allowing efficient gas exchange. In pulmonary fibrosis, scar tissue develops around the alveoli and surrounding lung tissue. As the scarring increases, the walls become thicker and stiffer. This makes it harder for oxygen to move from the lungs into the blood, reducing the body's oxygen supply. The symptoms often develop gradually and may not be noticed at first. Common symptoms include shortness of breath, a persistent dry cough, fatigue, unexplained weight loss, and reduced ability to exercise or perform physical activities. As the disease progresses, breathing can become difficult even during routine tasks. The exact cause of pulmonary fibrosis is not always known. When no clear cause can be identified, it is called idiopathic pulmonary fibrosis, or IPF. In other cases, the condition may be linked to long-term exposure to dust, environmental pollutants, certain medications, autoimmune diseases, or previous lung infections. Pulmonary fibrosis is different from conditions such as asthma or COPD because the main problem is not narrowed airways, but permanent scarring of the lung tissue itself. The understanding of pulmonary fibrosis has improved as scientists studied how inflammation and tissue repair can sometimes lead to excessive scarring inside the lungs. Although there is currently no cure for pulmonary fibrosis, treatments are available to help slow the progression of the disease and improve quality of life. Treatment may include medications, oxygen therapy, pulmonary rehabilitation, and in some cases, lung transplantation. Today, artificial intelligence is helping doctors detect pulmonary fibrosis earlier and monitor it more accurately. AI systems can analyze high-resolution CT scans and identify subtle patterns of lung scarring that may be difficult to recognize in the early stages. Researchers are also using AI to measure how quickly the disease is progressing, helping doctors choose the most appropriate treatment. In some healthcare systems, AI is being used to predict which patients are at higher risk of complications, allowing earlier intervention. Pulmonary fibrosis is a serious condition that gradually scars the lungs and reduces their ability to supply oxygen to the body. Understanding how it develops highlights the importance of early diagnosis, proper treatment, and ongoing research aimed at improving outcomes for people living with this disease. But not all breathing problems are caused by scarring. In our next video, we'll explore sleep apnea explained and discover what happens when breathing repeatedly stops and starts during sleep.